Hello, everyone, and welcome back to a new episode on the Aging Together podcast. Our guest today is a best-selling author and expert in the senior living industry. Amy Friesen has worked with seniors and their families throughout the world. Amy founded Tea and Toast in 2014 to help seniors and their families gain access to better choices and reduce the stress and feeling of being overwhelmed. Treating each client holistically not only ensures a happier and healthy individual, but also aids in a successful transition to senior living. As Amy saw the needs expand throughout Canada, Amy formed Elder Care Planners of Canada, Canada's only national network of like-minded elder care planners dedicated to assisting families throughout their elder care journey. Amy has been recognized by the House of Commons for her 2018 Businesswoman of the Year award, as well as being a 2019 40 Under 40 recipient. In her most recent endeavor, she wrote a book titled Breadcrumbs, From Home Care to Care Homes. Amy, so great to see you again. Welcome to the show.
Thanks so much for having me. I love seeing you again. I'm excited to chat with your audience and tell them all the stuff that's in my head.
Yes, I love it. I know when we briefly first introduced ourselves to each other, we kind of went off on a tangent rabbit hole because you and I share a lot of similar passions when it comes to home care and care homes and just the senior living industry, but also being able to exchange how different or how similar some of the challenges are, even across borders.
Absolutely. When we work throughout the world, right? Lots of people have their loved ones here. And so when we're navigating here, there's more similarities than differences. I think the main differences always come down to the healthcare systems and how they run.
Yeah, for sure. Let's start with your latest endeavor, which is the book you wrote, Breadcrumbs, From Home Care to Care Homes, and maybe share a little bit about your personal caregiving journey and what inspired you to write this book.
Sure. So I've been in this industry in senior living for 20 years, and I strive with Tea and Toast, we're going to be 11. I strive to offer as many resources as possible to families. And I was really finding that a lot of families hesitated to look into things and be involved with other professionals because they weren't really sure where they, what they wanted to look for, where they wanted to make a move to, or whether they wanted to make a move. And so I felt like maybe putting something out in book form that has a little bit more of a broader audience than our website may help to bridge that gap. No one knows what we read at home, right? You can just read it and go through it, and it doesn't have to be a big deal, but it's chock full of different things to really reassure the caregivers that they're not alone, as well as the fact of, what the history of senior living has been and how that impacts caregivers in different ways. And a lot of people really enjoy the little stories that I put in of my actual clients of how they solve their issues. And so that's been really helpful. And surprisingly, a lot of people really enjoy the last chapter of the book, which is like, where are they now? Because everybody wants to know what happened to people, right? So that was a bit of a surprise, but I really enjoy that.
Yeah, humans relate to humans, right? So they want to know, okay, they had this situation, this is how they handled it, and this is what the outcomes were, right? There's so many of us out there that can tell people what to do or guide people in what they should do, but there's not a whole lot we do afterwards to see, where did that lead them to? Where did they end up, right? And then being able to share that back. And so that's fantastic. You mentioned that you at Tea and Toast, there's 11 of you now. What does your role as a care navigator involve, and how did your experiences shape your approach to supporting caregivers and families in this way?
I shaped my business in two different ways. I shaped it as the owner and the kind of the boss. And then I shaped it as what families needed. And so when I started Tea and Toast, I really wanted to offer my colleagues and my employees a safe place to fall, a safe place to come to me with concerns, taking care of their mental health, making sure they have access to everything. because this kind of industry, we get a lot of compassion fatigue. And so I really wanted to make sure that they really felt supported. I unfortunately did not have that in my previous career. And so I really strive to make sure that my team gets the most support that they could get. And then for families, I saw a lot of people coming into the homes that I was working in, and they were just really overwhelmed. And they would really come to me as like a last ditch effort. They didn't know what they were looking for. They hoped because my home was close to their home that it was the right fit. But more often than not, because of, budget or because of care or whatnot, it wasn't a great fit, right, for those specific people. And so I really thought that this could be a lot easier, but the elder care navigation world didn't really exist in a big way where people could find those tangible professionals to help them through that whole journey. So that's really what I wanted to form up and give people peace of mind and give them guidance and give them kind of, back in my career, I've named it, a rent-a-daughter kind of thing, like someone who knows that industry, but also is close enough to you that you can have those intimate conversations and we can go through it and really pare down to see what best fits.
I love that. So I know in the US, we have aging life care professionals who are also, geriatric case managers, care managers. And then that's essentially what they do. And is there something similar, or is that what you're building?
From our previous conversation, I think we have similar, but not exactly that. I think that the United States is much further on this elder care journey than Canada is. When I started like almost 11 years ago, I could barely find another person like us, another company like us. And that's why I started Elder Care Planners, as you mentioned, that, I really wanted to make sure that if we had someone that needed help in BC or we had somebody that needed help on the coast, on the East Coast, then we could, give them the proper resources. And so I just kind of started my own association trying to link all of that together for people, because it's hard enough to find elder care planners. I find even in the States, it can be really difficult to find them if you don't know what you're looking for. And so everything we do is try to make the caregiver journey a little bit easier.
Yeah. Yeah. For the majority of our audience who might be listening from the US, can you give an idea of the landscape, the geographic landscape that you're trying to cover when you're talking about Canada? Because it is very large and it is also very rural. And so to have such a small number of you who are trying to accomplish this, I just want to get people to understand like what you're tackling.
Yeah, it's a good question. That's very difficult, right? So to your point, there's not that I can find. I don't have any elder care planners in north of Canada, right? In the Yukon and the territories. And we went across the provinces as best as possible. But to your point, there's more elder care planners in certain populations. Like in Ontario, we have 6 in my group as it is, and then there's more and more in Toronto and things like that. But as you move through the different provinces, there's just not as many, and they're really difficult to find. So, for instance, like we don't have an elder care planner in Manitoba yet. We need people to look at entrepreneurship and look at this kind of market of people that need help and start those small businesses. And ideally, that's what all of us are. We're linked together, small business owners with a common goal in mind to help these caregivers find what they need in elder care, whether it's direction or planning or making a move. We're all trying to do the same type of work, but I find that binding us together gives us a little bit more of a voice.
Since we're on the topic, what are some of the most notable differences between the US and the Canadian healthcare systems when it comes to elder care and caregiving support that you know of?
Yeah, it's difficult. I mean, we had a conversation before, and there's a lot of similarities in caregiving, right? Like the caregiver aspect is very consistent across the world. There's struggles, there's different things people are dealing with, diseases, progressive things for healthcare, all of that. I would say between the U.S. and Canada, it really comes down to the medical systems, and you'd have to school me in a little bit of this, but more of the ways that your government's covering different things in senior living, whereas ours covers long-term care, but we have retirement homes that are completely private. And so there's no subsidies. I speak from an Ontario perspective, but there's no subsidies really that available. And so a lot of our coverage comes straight through our government system, whereas I think a lot of yours comes through like Medicaid and Medicare and different things like that. Correct me if I'm wrong, but
Yeah, so similar to yours, Medicaid's the only government assisted program that covers long-term care. Medicare might cover add-ons such as like respite care or therapies, home health therapies, hospice, things like that. But the true caregiver piece is state dependent based on the local Medicaid system. And so that's also hit or miss. They're starting to introduce some more caregiver benefits like tax breaks and stipends and things like that. But, with our current administration, I'm not sure how much of that's going to go through. Yeah. And so overall, it's becoming more privatized, I would say, from a caregiving support perspective. So there's more and more of us elder care consultants, advisors, kind of starting practices that we have a pretty strong directory of geriatric care managers, or they're called aging life care professionals, that are spread throughout the states. And so, but again, it's all privatized. And so that's where it also becomes a access issue for a majority of the population. And yeah. And so it's difficult to try and get everybody the support that they need.
I was going to say, like, same here, right? Like we see families all the time that can't afford private and can't get into public because we have wait lists and things like that. And a lot of people, because in Canada we have like a governmental healthcare system set up, right? So a lot of people feel like anything healthcare related should fall under there in subsidies and whatnot. And it's a really large misconception. And we have to teach people that a lot of times. That unfortunately, there is private sector, not unfortunately, fortunately, there's private sector to be able to care for people if they can afford it. But unfortunately, the government's not going to chip in on a lot of it. And I can't see it getting too much better, which is unfortunate because to your point, there's so many people that need that extra monetary help. And they also need that direction and to know that as they age, there's going to be somewhere or someone that can help take care of them. When I wrote Breadcrumbs, I had a number of people reach out to me and ask me to write another book about solo seniors, because that's a whole other ballgame of people that didn't have kids, don't have relatives. What do we do? And that's a very interesting thing that I've been looking into recently.
I love that. And I also love the moniker of solo seniors. I've seen like the forgotten elders, in that perspective too, of, again, the ones who don't have families and don't have relatives and they're just aging on their own in the world, and what that looks like for them. I also just want to call out the creative genius of your company name, Tea and Toast, with a book followed by breadcrumbs. Like, how did you think of that?
Well, when I named the business, it's incredibly difficult to name a business. I struggled, and I really went on the fact that Tea and Toast was very familiar for other reasons, right? Because it's a syndrome essentially, and I really wanted to have people connect with that. And what's been interesting over the years is that when you know kind of thing. It's like when you get into that lane, all of a sudden it makes sense, right? So if you're before that time, maybe you don't find me or whatnot, because Tea and Toast really is a nutrition issue. And so seniors are often eating tea and toast for multiple meals. And so when multiple meals start to happen, the caregivers start to worry about that deficiency for nutrition, right? And so that was the leading part of it, but also Tea and Toast makes people feel comfortable. And I've been told more often than not that, when people look at competitors and whatnot, they choose us because they see the names, and that immediately gives them comfort, which is something I didn't know was going to be such a driver in our business, but I'm really happy about it. I'm really happy that we can start off on a comfort step. And then I think Breadcrumbs was the natural follow on that. And it's because people are literally coming to us and they have breadcrumbs of information. They have, oh, I know this about long-term care. And it's like, oh, no, you're wrong. You only have a piece of that. I know this about retirement. No, that's wrong. You only know a piece of that. And like, so they literally just have these morsels of information. And so we have to connect them so that they have a full picture. And that's what we do all day long.
That's so true. I 100% agree. When I work with clients, they have little itty bitty pieces of information and they're trying to make sense of it all. And I'm like, well, all of these pieces don't add up to the whole puzzle, right? We need to
Right.
figure it out. So I think that's so cool how you connected that. So kudos to you. Back to what we were talking about. So I think we obviously both have pros and cons within our systems, especially within our healthcare systems and care systems. What unique challenges or advantages do you see to how caregiving is addressed in Canada? And then I can kind of fill in on versus how the US handles it and kind of the pros and cons there that families should be aware of.
I think that, a lot of people, kind of going back to a previous point, that we have, mainly two types of systems right here in Canada, and there's not a lot of gray zone in between. And, what do you do if you don't qualify for long-term care but can't afford retirement? And so I think that a lot of caregivers are struggling with that in-between zone. And I don't know that I'll wait to hear what you say as well, but I don't know that there's as many differences between us as there are similarities, because I think that the caregivers are just struggling to get through the day and try to figure out who's going to care for mom. Do I take off work? Do I care for mom? Do I have to go on leave? And they're just trying to figure out those pieces. I feel like family caregiving is really, not talked about enough. And I'd like to say things are changing, but I haven't really seen that much change. And I think that it's taken for granted by our systems that, most of the caregiving that's happening in Canada, and probably in the US and anywhere else too, is all family caregiving, which is okay. A lot of people take care of their family, but when you look at where we are today versus where we were 20, 30 years ago, our families are all spread out so far that a family caregiver back in the day might have really worked. But now you've got kids that are, on the coast and their loved ones here, or the kids are across the world. And it's like, okay, well, what do we do? If that family caregiver piece is removed, do we have the money to afford this extra caregiving and whatnot? It's challenging.
Yeah. Yeah. We definitely talk about that a lot within our community, where there's definitely a lot of care across generations and across borders that are happening, right? The South Asian diaspora is spread out all over the world. And sometimes our generations here, our parents are back in India or they're in different countries. And it's starting to become a really big issue. And, this is almost the first generation of families that are no longer living in those generational villages, is what I like to refer them to, right? There used to be a time, and I still remember this, like growing up, people never moved out of their towns, right? And so generation after generation, all the community knew each other, everyone supported each other, families just grew together, and there was always that level of support from your neighbors. And as I've grown older, I moved away from home, and I've seen so many other people move away from home. Now when I go visit my parents who haven't moved, I don't know anybody in the neighborhood. Everybody has moved out and onwards, right? And so it really is a shift in that dynamic of, yes, it takes a village, but that village no longer exists. So how do we create that village to fully support not just the elder, but also their family, so that there's a clear line of communication, there's clear access to services and resources that is also accessible and affordable, right?
Mm-hmm. Well, and to your point too, when you're dealing with different backgrounds, such as your background, there's a lot of people that are in the US and in Canada that have moved, just like you're saying. And they don't want to take care of their elders, which is fair because we're all doing different things now, right? Like we're all working out of the house or we're all doing whatever. And so with that comes this, sense of guilt that comes with it. And so it's like we thought caregivers already had it hard. And then let's just pile on some extra generational guilt and different backgrounds for guilt and all of this stuff. And I always say, learn to dance with guilt because it's going to be there regardless of what you do. You can make the best choice and still be guilty. You can make another choice and still be guilty. So I think that that's adding to the mental health strain of all of this as well, is that, we have lots of clients with various backgrounds. We're very multicultural in Canada and we have all this going on, and they're upset that they can't take care of their mom or dad. They don't have the resources. They don't have the space in their house. The house has stairs, all of these different things. And so they also have to navigate all of that plus the guilt that comes from it.
Yeah. Yeah. Guilt and shame are two very big feelings that I address a lot, especially within my own diaspora, is just that it's, there's cultural obligations. There's that filial piety of, you have to take care of your parents. What do you mean? Right. And like you mentioned, a lot of times it's just not possible anymore with the demands of the world, the demands of jobs, and then also location, right? It's become increasingly difficult. And I almost like to frame it, I had this conversation with my parents, but it was almost this framing of, we can still take care of you. We're just going to take care of you differently, right? And that differently could mean financially and you outsource everything, or it could mean physically, but you're still hiring help so that you're not doing it full time, right?
Mm-hmm.
You're tapping into resources and helping them navigate stuff without you being there 24/7, right?
Yeah.
And so reframing what looks workable for you to minimize that guilt, but also understand the practicality of it, right?
Well, and setting those expectations, talking about expectations and setting the boundaries.
Right.
You know,
Which don't
I,
exist in many cultures.
right. Boundaries are hard too, but I'm a big proponent of, knowing what you can handle as a person because we only have, we're here for one life. Whatever happens afterwards, none of us know, but we're here for one life. And so, not everyone wants to use a large portion of their lives to be in this caregiver role and all of that, what that includes, because it can be immense. And I think that there's power to tell people it's okay. You don't have to do that. You can decide for your life what pieces you want to do, what pieces you don't want to do, if you want to do any of it, if you want to do all of it. It's your choice as a caregiver. And just be aware, even though you make the choice that's good for you, there will be guilt there because guilt's just part of it. But that doesn't mean it's a wrong choice.
Right. Right. I think we touched on a lot of the challenges, which, are accessibility, affordability, family expectations, the burden of care, location differences. I do want to touch on a few advantages that our systems do allow, though, right? So, at least in the US, I believe with the shift and increased availability of privatized options, people have access to more personal care. So they can truly find somebody that they trust and is located near them who can guide them through every step of the way without having to get on a wait list, without having to deal with insurance, without having to go through the hoops of, federal assistance or local assistance. And they can go directly to a care manager, care advisor, whoever it might be, and access those services immediately. Again, as long as they can afford them. But I would say that would be an advantage that I've seen is that people are more willing to get help sooner. And that way they're setting themselves up for success sooner rather than first of all, they don't even come to us until there's a crisis. And then at that point, then they go through the game of having to wait for services. And then now the crisis has gotten worse. And, they're all sorts of frazzled and stressed and all this stuff that comes with it. But at least this way, they have immediate access to help in a crisis situation or right before a crisis situation or right after.
Yeah, I think it's the same for, just general healthcare as well. I mean, we have a lot of our healthcare covered, but that doesn't mean we don't have to wait sometimes a very significant amount of time. And so, the healthcare aspects, like even look at like therapy and things like that. If you have the means to be able to pay out of pocket, you're going to get what you need faster. You're going to get it, you're going to have the choice of providers. You're going to have it, much faster. And then, for going through the government system, sure, we have coverage, we have different things, but I find that you need to advocate more and you need to be able to be in a spot where you can wait, which is sort of awkward with our long-term care system, because essentially you can't go on the long-term care. You can't be qualified to go on the long-term care list until you need the care. But then when you need the care, you can't get the care if you're going to go in the private system or the public system. And in my area, you need to wait maybe 3 to 5 years for that. And it's like, well, what do you do then? And so that's pretty significant. And so, if you have the means to do it, then private is sort of the way to go. I mean, after the pandemic, a lot of our retirement homes, which are private, started adding more care, 2-person transfers and things like that are more like long-term care level. They started adding it because the demand is just there. Like, people need the care. They can't get into long-term care. It's nice to say we have a public system, but most can't access it. And, if you're a couple or have a partner, you really can't stay together that easily either. And so a lot of people that are together go and they choose the private system because then they can stay together longer. And so there's definitely pros and cons, but I think it kind of comes down to, as usual, if you have the funds to do it, you're going to be a little bit better off because you can have those choices. You can have more immediate service and whatnot. And then on the other side, as planners, as we are, if they don't have the funds, then we need to have them start planning earlier. We need them to start looking at things earlier so that they have a plan in place, because if they can't afford retirement, they can't afford to fall in their home. They can't afford to, have an accident, have this, ongoing illness. They have to be on top of their health care.
Yeah, that's a great point. And something we bring up often, but I've never heard it phrased that way. Like, if they're not prepared for retirement, then they're not prepared for everything that could come with it. Right.
Mm-hmm.
So, yeah, I mean, a big part of the work on this side that a lot of planners will do. So what I'll do is try and set people up for success. Think long term of like, what is your plan? Like, what is your ideal long-term care situation or your ideal retirement situation? And can you afford it? Like, do you know what the going rates are? Do you know what affordability and accessibility looks like? If yes, then you're well set. But if no, we need to work with a financial advisor, an elder law attorney, estate planner to figure out how to set you up for success. So that could be a possibility.
I wonder if you find this as well. I find that the people that have the funds to do this are well planned or better planned than the people that don't. And I'm wondering if it's coming down to the fact that they're used to working with financial planners and planning stuff and, legal and things like that. Because I find that most of the people that we talk to that don't want to plan, I call them my ostriches, right? They stick their head in the sand. They hope they're okay. And they always tell me they're going out feet first. I find that obviously those are the people that need to plan more because they don't have the money just to save them. And they're the ones that plan less, in my experience.
I think it's pretty hit or miss here. You'd be surprised. I mean, based on what you're telling me, majority of my clients are pretty wealthy, and they haven't thought ahead, or they're planning for their parents, right? Who didn't think ahead. I also think just based on coverage here. So since Medicaid, which is the state-funded low-income federal assistance, or not federal, local state assistance, people who are living below that income line, that it's not something that they're thinking or worrying about because they're already on that level of assistance, and that assistance will cover long-term care. I also think it's a privilege to be able to think that far, right? Like to even think about, this is how I want to retire. This is how I want my care. This is how I want to die. I just don't think people who can't afford these private services have the privilege to even think about that stuff, right? They're thinking, they're just going day to day and they'll figure it out or they'll get what they get. And that's where you find a lot of these lower income facilities that have subpar services and care, right? I don't know how it looks in Canada. So you talked about the need. We also, at least in the Chicago area, there's a 1 to 3 month wait list right now. Sorry, 1 to 3 year wait list right now for assisted living facilities, depending on which one you want to go to. They shut down over 800 nursing homes last year. And they're planning to shut down almost 50% more of the existing ones. And most of these are being shut down due to subpar levels of care, and that is receiving money from the government to be run, right? So on one side, it's a good thing. But on the other side, I think rather than shutting them down, there needs to be higher standards of care that are expected. Because we need it. We need the services. And what's going to happen with all these shortages of nursing homes with an increasing aging population that's going to need help is it's going to fall on the families. And families are just not set up to be well-set caregivers. They're not trained to be caregivers, majority of them. And they just simply don't have the abilities or the funds to be able to do that.
Yeah, well, and to your point, I think that it feels as though our governments are coming out of the senior living business, right? It's like, oh, not a good business opportunity coming out. And really, like we do not, before they came out of it or before they start closing down stuff, we didn't have even close to enough. And so it scares me, as a professional, it scares me to worry about what is going to happen to all these people. After the pandemic in Ontario, we shut down 800 beds, not homes, but beds because of like the ward rooms, like the 4 people to a room and stuff. And, for individuals, that's good. But for our community, that's terrible because we just don't have the space. And so they're flushing them almost to the private sector, but then the private sector only has so much to offer and they can't, they're trying to, do what they're doing, right? Their private business. So, a lot of people can't afford that. And to your other point about family caregivers and training, it's kind of ludicrous, right? Like essentially we're leaving all of the care to all of our elders to the family caregivers, which is, usually okay, but who knows? And they have no training. So it's like, you wonder if the government, if they're going to back out of these long-term care homes and whatnot, maybe should be putting in some sort of training for family caregivers. At least give us something, right? Because they're not giving us the lodging or the care. They're expecting families to do that. And then to our previous point, the families are all spread out. So how are they going to do it?
Right. In the US, at least last year, they introduced some caregiving training programs specifically for dementia population across, like at a federal level. And then certain states are putting in more funding towards that stuff. So we are seeing a shift a little bit towards caregiver training and health and success and stuff, but it's just not enough. I think we're 5 years too late to the game, and it's just going to be really hard to play catch up.
Well, and I mean, those of us who have been around for a while, we knew this was coming, right? And it's like you can't talk to someone in our sector of elder care, retirement, long-term care who would not tell you, oh no, we've seen this coming forever. All of us know. And it's like this whole industry of people that are screaming, we know this is happening, please pay attention. And nothing, right? And even in my book, I talked about, long-term care, which was nursing home at that point. That's the terminology. Around the 60s, around the 50s, like it wasn't what it is today. And it was a combination of, people that needed psychiatric help and like people that had no money and all of it, everybody together. And we were already saying, hey, this isn't going to work. We need more stuff. And sure, they separated it, but I don't know that we got any further. We got some new homes, but they're not building them as quickly as we're aging. And to your point, we're way behind. I don't know that we'll ever catch up, and that's terrifying.
Right. For sure. I agree with you. I want to touch briefly on if you've navigated any situations where families are carrying across the border. So, if there is that navigation across the US-Canada border where a parent lives in Canada and a child lives in the US or vice versa, have you noticed any common issues or obstacles that they face and sort of how can they overcome those?
I think a lot of the common issues is, wherever you live, you understand your medical system, right? Wherever you are in the world, even, right? And that, that's also equal for Canada, US. And you guys have a very different medical system than we do. And so, when we're dealing with adult children that are in the States, the expectations are different from them, right? And so we have to kind of school them on what happens here. And expectations don't match, so it creates more of a barrier trying to get this care and then to come up, because you want to see, like if they're moving to a retirement, you want to see where your loved ones are moving and all that stuff. We've introduced video touring and things like that to make people's lives a little easier, but it's difficult because on the plus side, if they can find one of us, they have us to guide them, and we can walk through the whole process, like I said, like kind of like another member of the family, and get them through it. But one of the large things we deal with is like that expectations. And to that point, we deal with a lot of people that are quite stubborn sometimes to say, no, it's this way. And I think that, if you're not from the place that you're, trying to navigate, looking to the locals and like, how does your healthcare system work, and not assuming, because we're all different. Even between provinces, we're different. And so really finding that local person is super helpful if you're not from there.
That's really helpful to know, because I think as someone who was born and raised in the US, we have a very specific perception of what the Canadian healthcare system looks like and how it works. We don't actually know. We just speculate based on things we've heard or things we've read. And I anticipate there's a similar level of perception from in Canada for the US healthcare system, right? But when we come across these people, I did have one client who was like, do you work on like Canada stuff? And I'm like, I really don't know how their system works, so I can't really help you. But now I know I could just reach out to you and be like, hey, can you help this person out? Right. And that would be an excellent way for you to then be able to guide them based on the local resources and whatnot.
I mean, we're in Ottawa ourselves, and so we're right on the Quebec border, from Ontario to Quebec. I have people reach out from Quebec and say, can you help navigate? And my loved one wants to move or whatnot. And I default to, there's an advisor in Quebec. And it's like, I don't even touch it, because I could stumble through it. I know enough because I'm a professional, but the systems are different in between. So why not use someone that's actually doing it all the time right in that area? Which is why also, like I said, with the elder care planners, I get people asking me for Alberta or BC or Halifax or whatever. And it's like so nice to be able to say, you know what, I know the person, let me just refer you over. And I think that as professionals, that's such a nice working relationship. I mentioned before when we were talking that I've come across a lot of elder care planners in the States. I've had, conversations with people in Michigan, and you're in Chicago and Florida and all that stuff. And it's like this network of people that we all have this common goal to like help these caregivers and families. But because we are constrained by our healthcare system, essentially, like you said, even between states, right? It's so much better. It's such a better customer experience as well to say, you know what, I've got you. I'm not your person, but Sally is your person. Let me connect you and help you through this.
Right, right. That's a big piece, right? Just referral and resource navigation. I mean, there's so much stuff people can find online and they don't know which direction to go in. That's where we come in. We know which direction to send them in, and it's a much more tailored approach and tailored recommendation process that they can then trust and follow versus spending hours trying to Google how to get help.
For sure. I've done that. I mean, when I was putting together the elder care planners, I was Googling a lot and I knew what I was looking for. And so the problem that I kept coming across, because I did it for US and Canada, because I was looking for different people for different things, not many people say we're located in, right? It's the website's up and there's no actual location of where they are. And so if you really want that tailored service, you really have to know. And so I went through multiple people trying to find someone in the area that I was looking for. And if I'm having trouble navigating it, I feel for the families because it's just not out there.
Right. I always joke about, I think every industry is just paid to Google, but they know what to Google.
Right? Yeah, it's true. Yeah, we know
we could try Googling, but we don't know the words or like the specific language that we should be looking for or the specific credentials or whatever it might be, right? That's where it's like, yes, I'm also going to do a Google search, but I know what to look for.
Yeah. Yeah. But that's the thing that comes with experience and knowledge, right? Like we are well versed as planners and whatnot. We're called different things depending, but we're well versed in that whole arena, even down to, assisted living versus long-term care versus nursing versus skilled nursing, all of the different words that some of them just mean the same thing or are interchangeable. They're very confusing, right? And it's like, if you reach out to one of us, we'll be able to maneuver you somewhere. I haven't come across someone in our field that would not help someone. You know what I mean? If someone called us and they were in Texas, I would look to help them, right? We don't just, dismiss them because that's what we do. It's a heart-centered business. And so we want to help. We want to give them, navigation and resources at the very minimum. Even when people come to us that have really low budgets and they can't get into long-term care and they're stuck, we might not be able to help them in a full way that we want to, but no one leaves us without some sort of direction and resource.
Yeah. Yeah. I have a legal question for you if you've navigated this before, but in the US, we have these powers of attorney and healthcare advance directives and living wills. Do those stand across border? Like, are they valid? So if a parent lives in the US and well, I guess if they live in the US, then that's not an issue. But if they live in Canada, like, do they have similar forms that they fill out that would allow the children in the US to be able to provide or dictate their care?
So not a legal professional. But
right.
You got to say that, right? I'm not a legal professional.
We're not legal professionals.
Nobody write me on this. I have talked to a lot of people and I feel like that I've heard that the power of attorney and whatnot just needs to be from where they're from, like an Ontario POA or whatnot. So I would suspect that, if your loved one is moving or whatnot, they would do those legal documents where they are. And then I don't know that it matters where their kids are. Like if they want their loved one to be power of attorney for health and finance and they're in Chicago and we're in Ontario, I don't know that matters. I'm not 100%, but I don't know that matters. I think it's just the legal document needs to be where the person is.
Yeah, that makes sense. That totally makes sense. And I'm hopeful that is a process. But again, we're not legal professionals. We don't know what the actual answer is. We're just trying to understand maybe.
And we're both going to go Google it afterwards. So
right. Yeah, we both are. I might shoot an email to some of the lawyers I know.
Right? It's a good question though. And the thing is like you think that you've kind of know all the questions in our sphere. And then someone's just like says a random question. You're like, I haven't really thought of that in depth, right? Enough to give like a good answer very specifically. It comes up every once in a while. And you're like, but I love those questions because I'm a problem solver. So it's like, I will find that answer for you and me.
Yeah. I think there's also a bit of like similarly legal issue where, again, we might not know the answer, but we're going to look it up later. But like between states, we have this issue too, where let's say So in the States, like someone is from, like my parents live in New Jersey, right? So all their documents are filed in New Jersey. They have all these services through this local New Jersey government. And then if they were to move to Illinois so that they could be closer to me so I could provide care for them, we have to shift a lot of those services over, and they might not qualify for some of those services that they were receiving in New Jersey in Illinois due to differences in eligibility and accessibility. Now, that's at least in the same country, but I'm curious, like, let's say the child moved to Canada and now the parents are US citizens and they move to be closer to their kid in Canada. Do they have access to any services?
The closest comparison that I have is, again, between Quebec and Ontario, right? Like it would be very similar, except for the fact that there might be a citizenship situation.
Right.
But in Canada, like when you cross the border, like, so in Quebec, they have CLSC, which is the government part, and we have Ontario Health at Home. And so you are eligible for service, but you're not eligible until you get an OHIP card, which is our health card. And so you have to put that in place, and then you go through the process of qualifying and whatnot.
Right.
I'm not 100% that it just switches over. I think that you have to still qualify where you're at. It's like when people move and they're on a wait list even in Toronto for long-term care, they still have to reapply to the homes on Ottawa if they're moving. So it needs to be localized, I think, more than anything. And so I think that from US to Canada, you have that piece of the health card, that issue, but then you also have the citizenship part of that as well.
I was going to say there must be some requirements to even getting that OHIP card.
Yeah, I don't know what they are for Canada to US. You have to apply before COVID. There was like a 3-month wait and they would do, their assessment or whatnot. And now I think they've tried to reduce that quite a bit because so many things happened after the pandemic that, they moved everything around. So
yeah, that makes sense. I think as we start kind of wrapping down from the intense topics, we've talked about why it's important to plan early from a financial standpoint, from a legal standpoint, but this becomes even so much more important when care is across borders because both sides just don't know what each other's expectations are, but also what each other's accessibility and affordability are, right? Because they're so different as we've outlined. And it seems like here, we're used to that difference in care from state to state, but it looks like that difference is even greater between provinces and territories up in Canada. And so it's really important to know what you're walking into proactively so that it's not during a crisis situation that you're trying to manage all of this, right? So,
ask the questions, right?
But people don't know what questions to ask, right? I think I get that a lot where they don't know what they don't know. And so they think they're going to just cross that bridge when they get there. And I absolutely despise this analogy because it's just one of those things where, yes, most things in life, you can cross that bridge when you get there. But generally, when the bridge is coming, how long that bridge is, who's going to be on that bridge with you. Who's not going to be on that bridge with you, if you have enough gas to get over it, right? Like generally you have an idea in life when you're trying to wait for things. But in this situation, you have none of it. You don't know any of it. You don't know how long that bridge is going to be. You don't know when it's coming. You don't know who's going to be there with you along the way. You don't know who's not going to be there with you along the way. You don't know how much it's going to cost. And there's just so many unknown factors. And yeah, I rant on that analogy all the time because I hear it so much from people. And I always try to hone in on the fact that there are too many unknown variables for you to not think about this now.
I 100% agree. And I think that the extra variable is, in senior living, it comes up a lot, but like care and whatnot, is that we don't have enough generations under our belt who have experienced it to be able to say, my grandma did this, my parents did that, and have gone through it. Most of the people that we're helping through the senior living journey and the care navigation and stuff like that have never had to do it. they don't have any experience. And it's just, even in my family, the only person that I can remember is my great grandma in a long-term care home back home. And that was when I was like 9, right? And it's like everybody else, my other grandparents died without even going to homes, for various reasons. That's my own personal experience. That's it. And I do this for a living because I come from a different background of, retirement living and whatnot, helping other families through it. But, most people don't have enough generations under their belt to have that experience. And so to everything you said, plus that, I'm with you, right? Most of us as professionals are just like, please plan, like, please look at this. Let us help you. It's not as painful as you think it is. And I always tell people, if you have two sides of the coin and one's not planning and one's crisis, the plan is going to be way less painful.
Right.
And
They're
you
both
can
going to be
spread it
painful,
out.
but one's going to be a lot less painful.
Right. And the planning, if you start early enough, you don't have to do everything. You don't have to have all the talks of elder care at the same time. You don't have to plan everything at the same time. But when you're in crisis, every single thing has to be done.
Mm-hmm. Mm-hmm.
And so,
yeah, that was a great point you brought up about the generations. The immigrant generations immigrant populations in both of our countries, this is their first rodeo. This is quite literally their first rodeo. It is the first, at least for the South Asian community in both US and Canada, it's the first wave of immigrants who came here in the 70s, 60s, who are now aging, and their kids were all born and raised here in the Western world, and they don't have or share the same values, or they don't have the capacity to offer the same level of care that they offered their parents, that their parents offered their parents, right? And you're seeing that challenge over and over again now. And we just don't have the systems to support these immigrant communities.
no, not, flat no, right? Like,
we don't.
I don't even have a way to expand on that because I just agree. It's just like, you don't, it's very difficult.
It is. So I know we've briefly touched on like how people can prepare, but specifically, what advice would you give to families who are trying to coordinate care between the US and Canada, especially, when they're dealing with these varying policies and insurance systems and care standards and kind of level setting? What advice do you have for them?
I think it's similar advice to, if you're navigating this elder care world, even if you hook onto someone locally, a home care company, a retirement home, an elder care plan, anybody, and use them as a springboard to say, okay, this is what's happening. Can you, do you know someone, or do you know the right lingo that I can type into Google, and bounce through? Although it looks like, on the onset that you're being bounced from one professional to another, because you are, the purpose is to find the professional where you're going, because you need that local person, but sometimes you can't find that. And you might know someone who knew someone or did this already. And so I would say open up to the conversation with your community, open up to the people that you work with, open up to whomever, and look for that information purposely. Make time in your calendar, sit down for an hour, look for that information as soon as possible, and get a professional. Because, most of us, I know I'm biased because I'm a professional, but honestly, it's such a difficult thing to navigate. The whole world of senior living and elder care and whatnot is really, really difficult to navigate. And so, I've compared us to brokers of retirement home before, right? Or real estate agents of retirement home to get people familiarized with what we do. But, if we need insurance, if we need mortgages and whatnot, not all of us, but many of us use brokers and professionals to get that done. But for some reason, there's this block because we're harder to find as elder care planners. But just stop and think, okay, is there some sort of professional that could help me with this? Because I think that if you just have that one thought, then you kind of can start those wheels spinning, as opposed to what many people come in and say, oh, I have to do this all myself. Like, I've had people say, oh, I took 3 months leave. And it's like, well, did you Google for an hour? Did you talk to somebody before you took 3 months leave? Because I feel like, as someone that's not in their situation, I just feel like it's a bit much to have to take that much leave from work when really, had you just, block out an afternoon and go and search for it, and ask people and talk to people, there's lots of people who have similar experiences that they could probably start directing you and ping ponging you down to your local person or wherever that is.
Yeah. Great advice. Other than elder planners that you have built across the country, are there specific tools, organizations, or resources that you recommend for cross-border caregivers that could maybe help simplify their journey?
I think that what we probably have more in common are like our associations, right? Like Alzheimer's or dementia associations, Parkinson's, MS, all those types of associations. So if anybody's dealing with that type of stuff, I think that those would be the easier things to find, right? And plug into those so that you can get that extra assistance. Unfortunately, a lot of people end up in hospital and then their kids are trying to plan cross-border and whatnot. And so although the medical system has a knowledge of some of this, I wouldn't necessarily say that that's kind of their playground. Like they don't know enough about senior living in the private sector, for instance, and things like that. But ask those questions while you're there because they may be able to do something for you and they may be able to direct you somewhere.
Yeah. Yeah, definitely. It's very similar here as well. We have all the wonderful social workers and case managers in the hospitals who get them to the next level of care and try to offer them resources in the community, but they simply don't have all of the ground level exposure and experience with what's all available in the private sector and in the public sector at a community level. And so it's always helpful to have some sort of handoff and like access to somebody who does this in the community.
I think too that like if you're going through hospital associations, community associations and whatnot, I think it's important to know like those are a great start point, but don't take everything verbatim. Like don't take it all as the word, and use it as a start point and then start looking into it because I find that in healthcare specifically, you have to advocate constantly. So don't just assume, but use it as a start point to say, okay, this is the direction, and let me look into it a bit more because advocating is always going to be there, whether it's for yourself or for your loved one. We constantly have to do that. And so just keep it in mind when you're searching. It might not be 100% of your answer, but it might give you a next step to look at.
Yeah, definitely. We touched on policies and systemic barriers. Are there any policies or systemic changes you'd like to see in the US or in the Canada to better support caregivers and older adults in cross-border caregiving? And what do you think could make it easier for us to be able to help out those families who really need that cross-border support?
I think that, I don't know that the start point is between the countries. I think the start point is between the states and the provinces. I think that making kind of like a comparison chart, right? It's like, this is what happens in Saskatchewan. This is what happens in Ontario. This is the equivalent, right? Making services sort of like their equivalents available and so people can find that knowledge so that they can operate in their country, and the same with the states. Like make it more palatable for the people that are looking for the information that may not have professionals to deal with it. I mean, I'm sure you and I both struggle from time to time too, finding this information because, it's difficult to find. We just happen to know what we're looking for and we persevere, right? So
Yeah.
making it easier in our countries to navigate sideways and up and down, so that we know what the comparables are. And then once we can get to that point, then making it easier cross-border because we're obviously so close that's a very usual thing, and having that education. But the thing is that like even as you mentioned, there's differences between sorry, did you say Medicaid or Medicare?
Medicaid, which is state level.
Yeah, so there's differences between your states and Medicaid, right? And so as a Canadian, I would not even know where to start with that, right? Because it's so different from ours. But even in your states, trying to like have the same language, it doesn't necessarily exist. And same with us. Out west, we have personal care homes. And so because I'm connected across the country, I have asked my other advisors like 3 times, okay, explain this to me, because I don't have that. And it's like, I can't conceptualize where it fits in my world of like whatnot.
Yeah.
And so we're already having that difficulty in our own country. And I'm sure you're having that in yours. And so I think that we need to start making it a bit more standardized, because families are so far away. If we can standardize it more so, or at least have some sort of key to look at and be like, this equals this, it would be so much easier for families to be able to conceptualize what that information is.
Yeah. Yeah. Unfun fact, Medicaid has a different name in every state. Like every state has its own brand of it.
That's hard. I mean, even here we do that. Like I mentioned Ontario Health at Home. In Ontario, they have changed that name. In my 11-year career as Tea and Toast, I think they've changed it 4 to 5 times. And so when I do presentations now, I have to say the LIN, CCAC, OHAH. Like I have to like literally say them all the acronyms, because they keep changing them, but barely change the service on a level that clients would know or families would know. And so it's just like, stop changing the names, like just make it so it's easier. But I feel like, to be honest, I've had this conversation before, but I feel like a lot of the policymakers and whatnot are actually just in the same bucket as we are. They don't have the experience of having to have a loved one in retirement and long-term care, in care or whatever that is, and are not educating themselves on how the system impacts people, right? Because even that simple thing of the name change, it just confuses everyone, right? And
it does. I mean, and it also creates this disparity or this poor perception of like, oh, well, all these, like, there's not a lot of people on Medicaid, but that's because you don't know what the program's called. And so there, you'll see a lot of times they'll be like, I'm not on Medicaid, I'm on this X, Y, and Z plan. And I'm like, that's Medicaid. And they just don't know, because it's not branded as such, right? Anyways, I could go down a rabbit hole on our Medicaid system. But we do need to wrap up at the end of the hour here. And I'd really like you to tell us, what is the key message you hope readers will take away from your book, Breadcrumbs?
It really is kind of my key message in general to anybody, right? Know that although you feel like you're alone, I promise you, you're not. You're not alone in this caregiving journey. There is support. Even just like I said before, speak to your colleagues, speak to your neighbor. If you have, if you're able to be brave enough to open that conversation, you will find support. It's there. It's happened many times for my clients, for family members that we're helping. It's just being brave enough just to have that first step of a conversation, and follow through with that, because many people feel like they're the only ones that have ever dealt with this. And I would tell you that, when it comes to our business, we have kind of like, in my head, I have like buckets that people fall in, right? Like very specific, like care or finance or whatever. And more often than not, there's so many more similarities, right? There might be like tweaks, but they're more similar to the others than they think.
Yeah, definitely. Anytime someone says, do you know other people who are going through this? And I'm like, yes, 1,000% yes.
Yeah.
So
a lot of people. Yeah.
Yeah. All right, Amy, how can caregivers or families connect with you if they want to reach out to you in Canada? Or in Ottawa specifically, I guess, right?
Ottawa specifically, but so if you go to teaandtoast.ca, you can navigate from everything from there. My book's on there, Elder Care Planners is on there, all of the free downloads and resources are on there. Anything you need is on there.
Wonderful. Amy, thank you so much for coming on the show and sharing all your knowledge with us.
Thanks for having me. It's been a great conversation.